Hello, today we are going to present about the trigeminal neuralgia. Firstly, we will start with a brief introduction. Then, we will throw its signs, cause, diagnosis, prevalence, treatments, and some current research that are being studied. The trigeminal nerve is the fifth-part cranial nerve. It is also the largest cranial nerve and presents a sensory and motor innervation. The sensory branch transmits pressure, touch, pain, and temperature signals to the brain, and the motor controls the movement. The trigeminal nerve comprises two sensory divisions, the ophthalmic, V1, and the maxillary, V2, which comprehend the upper teeth, gums, and lip. The mandibular is the unique branch that has two types of innervation. According to the International Association for the Study of Pain, the trigeminal neuralgia is sudden, usually unilateral, severe, brief, stable, and recurrent pains in the distribution of one or more branches of the fifth cranial nerve. Trigeminal neuralgia is a pain located in the fifth cranial nerve pathway. Also, it's known as tique douloureux. Generally, neuralgia is not an illness in its own right, but a symptom of injury or a particular disorder. In many cases, the cause of the pain is not known. This type of neuralgia is characterized by sudden jolts of shouldering pain that usually affect one side of the face only, but it's not a life-threatening. The pain may be severe enough to cause spasms of the facial muscles. It's said to be one of the most painful medical conditions because it turns everyday activities, such as toothbrushing or shaving, into agonizing events. Trigeminal neuralgia may be caused by nerve compression from a tumor or arterial venous malformation. The pain of trigeminal neuralgia has been described as sharp and stabbing, or like an electric shock. It normally comes on suddenly and can last from several seconds to a couple of minutes. So, its most common symptoms are localized pain. The area may be excruciatingly sensitive to touch, and any pressure is felt as a pain. The pain can be sharp or burning, depending on the affected nerve. The affected area is still functional. The muscles may spasm, and the intense flashes of pain can be triggered by vibration or contact with the cheek. Sometimes the pain is severe enough to prevent a person eating or drinking, requiring urgent hospitalization for treatment and nutrition. There is often no known cause for trigeminal neuralgia. Occasionally, tumors in the region of the trigeminal nerve can be present with trigeminal neuralgia. Also, trigeminal neuralgia can be caused by a blood vessel pressing on the trigeminal nerve. This compression causes the wearing away or damage to the protective coating around the nerve, the myelin sheath. The pressure on the nerve causes it a misfire, resulting in pain. Other rare causes of the trigeminal neuralgia include multiple sclerosis, disease that attacks the myelin sheath, and strokes affecting the lower part of the brain. Additionally, trigeminal neuralgia may be part of the normal aging process, cluster headaches, or temporomandibular joint disorder. Another cause can be nerve inflammation or neuritis, which can be resulted by infection, such as herpes virus, tooth abscess, or syphilis. Because of overlapping symptoms, obtaining a correct diagnosis is difficult, but finding the cause of the pain is important as the treatment for different types of pain may differ. There are no specific tests for neuralgia. Diagnosis relies more on ruling out other possible causes, considering the person's history and description of symptoms, or executing tests that may include neurological examinations to determine specific areas of pain, dental examination to check for abscess that may be irritating nerves, blood tests to check for infection, or radiological imaging to see if the affected nerve are being compressed. The incidence rate of trigeminal neuralgia is about 3 to 5 cases per year per 100,000 people. The prevalence of this disease has been estimated at 107.5 men and 200.2 women for 1 million population. More recent estimates suggest that the prevalence is approximately 1.5 cases per 10,000 population. Some studies show that 2% of patients have multiple sclerosis. No geographic tendency or racial difference have been found for trigeminal neuralgia. In addition, in 9% of patients, the disease begins after 40 years, with a typical onset of 60-70 years. Some treatments that help the trigeminal neuralgia patients in the decreasing of pain are treatment for the underlying cause, such as dental treatment and antibiotics for a tooth abscess, or surgery to remove bone pressure against the nerve, and pain relief medications such as aspirin and codeine. Regular pain medicines are generally not helpful in treating trigeminal neuralgia. However, anticonvulsant medications have been found to be effective in relieving this type of nerve pain. The doctor will most likely prescribe an anticonvulsant such as carbamazepine for the initial treatment. Carbamazepine, brand name Tigritol, has been shown to be effective in relieving pain in people with trigeminal neuralgia. This medication slows nerve fire and can quiet an overactive nerve. Another medicine that can be used is baclofen, which is normally used to control muscle spasms, or antidepressants to help relieve pain in some cases. Also, surgery is an option if the trigeminal neuralgia is a result from a blood vessel compressing the trigeminal nerve. One example of these procedures is the microvascular decompression. It is the only method designed to relieve the source of the pain, such as vessel compression the nerve. In this procedure, the surgeon enters a skull behind the ear and opens the bone. Once found, the vessel is moved aside as a small piece of padding is placed to keep the vessel off the nerve. According to the Facial Pain Research Foundation, many research are being executed to increase the knowledge about the trigeminal neuralgia. They are: a neural signature of trigeminal neuralgia pain is coordinated by Andrew Wan, and it's a project to obtain a neural signature or map of brain in individuals with trigeminal neuralgia pain. It should provide fundamental insights into the neurobiology of trigeminal neuralgia, and can be crucial for the identification of people with greater risk for developing intractable trigeminal neuralgia and for whom tailored therapy using new medications and/or drug-free options such as neurostimulations and neurofeedback would provide effective and prolonged relief from trigeminal neuralgia pain. Finding the genes that predispose to trigeminal neuralgia is a research conducted by Marshall Davor, Kim Burcham, and Ziv Seltzer. Through the Human Genome Project, the capacity to relate disease with genes increased. This research aims to perceive if we have some genetic predisposition in individuals with trigeminal neuralgia pain. A research done by a Chinese group of researchers demonstrated that the mechanism of action of Botox has indicated that it may be blocking sensory nerves. The study was executed in 42 patients with trigeminal neuralgia. 68% of patients had significant improvement. The Botox injections are helpful because have fewer side effects than oral drugs.